Welcome to the Conception Channel podcast.
Hello, everybody. Welcome to another episode of the Conception Channel podcast. I'm your host, Spence Pentland, and I'm really excited. Our preamble was great, Ali, but I'm super excited to have you back on the show for, I think it's the third time we could go back and look at, talking about the impact on men and Ferticom and Fertistrong and stuff, but we'll get to those things. Ali, or Alice, Dr. Ali Domar, welcome to the show.
Thank you so much. Happy to be back.
Awesome. Oh, I'm so happy for you to be back. It was nice to see you. It's been a long time, and our path back to one another. Obviously, I just a little background, and this will be an extended introduction probably for Ali, Dr. Domar. But I was, it's been 20 years now that I've been in the reproductive health field, like I was just telling you. But I remember your book, obviously, Conquering Infertility, was pretty landmark, and I don't even remember now when that would have been published.
Well, actually, no, I can tell you exactly because a revision is coming out in January. So I think it's actually it was about 25 years old. And then Inception decided that they wanted to start, so they wanted our patients to read the book. And so they talked to my publisher, and of course, they gave me 2 weeks to revise the book, and it happened to be 2 weeks while I was on vacation. So
Wow.
I revised the entire book while I was on vacation.
2 weeks. Okay. That's from 25 years, a lot, especially in the tech side of things, is advanced forward. But
What's actually really interesting? So much of the book is patient stories. And apart from like updating names, because like names that were popular 25 years ago are not popular now.
yeah.
And other than, changing high FSH to low AMH, there wasn't that much to change. The stories I heard 25 years ago, pretty much the same stories I'm hearing from patients today.
Some things are timeless. So that's the goal of writing a book, is making it timeless, right? Just to disclude the tech, and then it remains.
Yeah, there's very little technology in it because, I'm a psychologist. So, and what I really wanted to do was help women and their partners not just learn new strategies to decrease their stress levels as they go through this, but there are hundreds of stories from my old patients, ex-patients, prior patients, on what they were going through. Because if most infertility patients don't tell anyone they're going through infertility, and so they're very lonely. And so to read all these stories and think, oh my gosh, that's exactly my experience, it makes you feel more normal.
Dr. Domar is a health psychologist, if anyone missed that, since 1987. Had a long career at Boston IVF.
Yeah, so I started my career at Beth Israel Deaconess Medical Center, where I actually started doing infertility research. And then I started the Mind Body Program for Infertility. And I was there for 17 years. And then I actually just sort of moved over to Boston IVF, which is actually the part of the hospital. And I even now, still have my Harvard associate professorship. So I'm still an associate professor at Harvard Medical School. So I was at Boston IVF for 20 years, and then I joined Inception 2.5 years ago.
And over this time, since 1987 as well, just as a 30,000-foot view, Dr. Domar, or Ali, has done a plethora of research, focusing primarily on the relationship between stress and infertility. So that's just since 1987 where Ali's focus and intention has been. So if that intrigues you at all, please listen on. There will be a lot here for you, but primarily with the focus on the cognitive behavioral interventions, as well as access to care and patient retention, which is all so encompassing, and I'm so glad you're still diligently digging into all of that by the looks of your research.
I should have retired a couple of years ago. My husband retired 4 years ago, but I'm having way too much fun, and I feel like I'm finally doing what I was meant to do at Inception. So I can't say the retirement word to our CEO. It gets him upset.
No, just keep doing what you want, because then you don't have to retire. So that's what exactly. I want. Selfishly taking Ali. But so Inception, Ali mentioned Inception Fertility, joining it in 2022 after leaving Boston IVF. And Inception is a network of brands kind of that touches every stage of the fertility life cycle, and including, and this is kind of how we reconnected through our mutual colleague and friend, John Havelock. He's a doctor at PCRM, Pacific Center of Reproductive Medicine here in Vancouver, BC, Canada. But Inception has subsidiaries like the Prelude Network, which is IVF centers all over North America. You just told me there's a research division now that you're heading and sharing soon. There's tech, financing, egg bank, cryo, pharmacy, and even a supplement line, NutriBloom, which I think we're going to carry in our clinic soon. But they, and I love this so much that you joined them in 2022 and invented a title for you that maybe never existed before, but Dr. Domar became the Chief Compassion Officer of Inception Fertility. So that just tells me the forward thinking that Inception has.
Well, it was interesting because I had talked to the CEO, and I mean I was looking for a job, and I talked to the CEO, TJ Farnsworth, and I came out to Houston and met with every member of the executive team, and it was just like a love fest. Like it was just I still love everybody on the executive team. And at the end, like TJ brought all the executives together, and I didn't have a job offer yet. Like I didn't know what they thought of me. And so we spent like an hour tossing around titles. And I cannot remember who came up with Chief Compassion Officer. I think it's our COO. Someone else thinks it was TJ. Who knows?
Yeah.
And so I finally had to leave to catch my plane back to Boston. And by the time I took the elevator from the 9th floor and got into the car to get a ride to the airport, I had a job offer on my phone. So
Awesome.
that was just amazing. And it is definitively my dream job. It is what I've wanted to do my whole career.
Well, even just their Prelude network, I was looking on their website, they say offer compassionate care at every step of the patient journey. That's part of their tag. And I'm like, okay, yep, Allie should be in charge of that.
I am in charge of that. I mean, the fact is, no other network has a chief compassion officer. I don't think any other network has a psychologist in their executive team.
So when you say network, like fertility,
well, there are a lot of different networks now, that are, around North America.
Yeah.
There's, EV and CCRM and Shady Grove or US Fertility, whatever they're called. So there are probably at least a half a dozen good sized networks.
Yeah.
But I think what separates Inception from the rest is the focus on patient-centered care, and the fact that, clearly someone thought it was important enough to have a psychologist be on the executive team.
Yeah.
And I'm not shy at these meetings. They probably wish I would shut up.
Well, I don't know you that well, but we've met a few times. I don't believe that you wouldn't say I mean, come on. Everyone should listen. 1987, you've been focused and grinding in this same direction. Like you have so much to offer. I'm so proud of you. That's so great to have you.
Well, thank you. I mean, honestly, I was talking to a colleague and my friend Liz Grill the other day, and I said to her, I really hate confrontation. And she said, "Are you kidding me?" She says, "You confront everybody." And I'm like, "No, I don't. I hate confrontation." But I think as one, ages gracefully, it's like, what the heck? Like, I'm just going to say what I think. And these days when I talk to people, I'll say, I'm going to be pretty direct with you what I think, because with age and experience, maybe comes permission to just be more forthright with what you're thinking.
Well, I'd just like to give a plug to elders. I recently moved out of Vancouver to an island just off the coast called Salt Spring Island. It's a bit of a magical place. And one of the main attributes I see here that gives it a community feel is that, and that I think helps it stand out, is its respect for and reverence for its elders. And in a time, first, not just First Nations, just there's a healthy aging population here, and in a time where I think too many, so this is getting into my opinion, but where many people are listening to very young influencers versus experts, maybe sometimes, it's really super refreshing to me to have someone, like you at the forefront. It just has to be that way. You know,
Well, I agree, Spence, I can't agree more with you. So, one thing I hadn't really thought about is when you're chief compassion officer, every day or every other day, someone pitches some new product for infertility patients to you.
mm,
And, I'll sit through the pitch or I'll read the pitch and I come back every single time and I say, show me the data.
right.
Like, where is your randomized controlled trial showing that this, whatever it is, benefits patients in some way, that
Yeah,
significantly benefits patients? And they're like, because we think it does. I'm like, that's not good enough. Like, I'm
right.
not gonna introduce anything to our patients unless I know for sure that it's going to help them.
Awesome. Well, that's great. I mean, that's why you've been on the board. I'm going to just finish your CV here, or just give this brief, hardly your CV, but intro, but board of the Parents Magazine, uh, uh, and served for 10 years on the board of Resolve,
Yeah.
which is the National Fertility Association. Amazing. 8 books. Conquering Infertility is the one we spoke of that's getting revised, but there's others. How to integrate exceptional care, cutting edge technology, and co-creator of these apps. And I will chat about those because I know that there's some, since we chatted last, there's probably data that's come through on those, and I see that. And also a former chair on ASRM, which is the American Society for Reproductive Medicine, kind of the association for reproductive field in the US, mental health professions group. So that's amazing. And in Inception, you're in a special interest group somehow too. You're talking about with John.
Yeah. Well, there's a physician advisory board.
Yeah.
And, when the executives get to go to the annual meeting, which is
Mm,
really, but there's every physician on the physician advisory board is on a subcommittee, and he's on the research subcommittee. And
right.
I'm the
Yeah.
director of research. So, basically every month we send the members of the committee, you know, an update on new projects or projects we're thinking about or what have been pitched to us or results from projects, from research projects. And, I think within about a year of really getting the Institute off the ground, I believe now we still have, or we definitely have, more research trials registered under clinicaltrials.gov than
Mhm.
any other network in the US.
Oh, wow.
We are
Just
cranking. Because
cranking.
you know what? The only way to improve patient care is through research.
Mm-hmm. Understand what's truly happening. Yeah.
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 We all might think we have ideas of what might help patients,
Hmm.
but you got to prove it.
Yeah.
And I've been wrong many times. Like, I'll have a theory or a hypothesis, like, oh, this is sure to help patients. And then I'll do a study and I'm like, oh yeah, whoops, wrong. No.
Ah. So what you found there maybe is that your thought helped a few people, and you highlighted them in your mind somehow, and then you did the research and found otherwise, kind of, for on the whole.
Well, here's an example. Many years ago, I can't even tell you when, maybe 25 years ago, I had an intern who was an Episcopalian minister and decided in her 60s to get a PhD in clinical psychology. And so
Mm,
she did her dissertation with me. And being an Episcopalian minister, she was very interested in the impact of spirituality and religiosity on the distress from infertility. And she and I
okay.
had long talks. And I said, I think the most religious patients are the most distressed
Mm,
because they think God's punishing them.
mm,
And she said, no, I think the most religious patients are going to be the least distressed because they feel like God has a plan.
mm,
So her thesis, her actual PhD thesis was, what is the relationship between spirituality and religiosity and infertility distress? And
mm.
the results, we published them. She was right and I was wrong,
Huh,
that the most religious and spiritual infertility patients were the least distressed.
huh.
And I admit, I'll say it for the hills. I was wrong. She was right. But
Right.
now we know. And
Yeah.
so when I see a patient who is distressed, I always ask them, is there a faith that you grew up with that's still important to you? Or is there a faith you would like to explore? And I'll tell them, because what the research shows is spirituality, religiosity can really help you cope
Yeah.
with this strain of infertility.
Yeah. Yes. I would concur. That's amazing to point that out. Recommending people revisit going to temple or church or
Mhm.
is is common for me at least. People with faith, I mean, walk down the street a little lighter if it's true faith and it's not just, they're there and they're in it. I guess that would be the hard part to tease out. It's, what depth of faith is there, and
Well, luckily they're, validated questionnaires. I mean, the tricky part now, of course, is there are a couple of religions that forbid IVF.
yeah,
And so for patients who are deeply religious and very dedicated to one of those two faiths, it's very challenging.
yeah, yeah, yeah. Especially when they see around them, at least I'm not sure the situation in the US and insurance and just different medical systems we kind of belong to here, but we're in BC here, we're about to enter as of April 1st, 2025, one round of IVF on the government's tab.
Wow, that's fantastic.
Yeah, yeah.
Yeah,
And
in the US now, I just looked this up. I think 21 of the 50 states have some kind of mandated coverage. So we're not even halfway there.
yeah, yeah. Well, and when you see that around you, but your religion doesn't, that's got to cause a lot. Yeah, that's a complicated scenario for sure. Okay.
As it is though, if you look at South America, where the majority of people going through infertility are Catholic, and there
Mm,
are lots of IVF centers in South America. So I think from my clinical experience and from what you observe geographically,
yeah,
a lot of people go against their church and do
yeah,
IVF.
yeah, yeah. And maybe the preacher, priest, or whoever at their, their local place of faith has a little more of an open mind.
Hmm.
Yeah. Anyway, that's a big conversation.
Big
That's for
conversation.
sure. Yeah, yeah. So, okay, thank you so much for, I mean, that was all the intro, FYI. Yeah, introducing Ali, but circling around to the research of note. I mean, to me, there's a couple from the past, and if there's any you kind of want to kind of start off with, it would be amazing. But if it's the relationship between stress and infertility as kind of this 30,000 foot view, can you
Hmm.
kind of define stress? Because it's the term is thrown around a lot, and
It
it may be
is.
missed because of it.
So, the way I define stress is not having the resources in your life to meet the challenges of your life.
Mm,
And the result can be anxiety, depression, anger, isolation, guilt, shame. There are a lot of ways. Stress is actually not a great word to use for a researcher.
hmm
So, generally when I do research, there are a couple good stress scales. Like there's a thing called the perceived stress scale, but
Yeah.
I generally focus on anxiety or depression or infertility stress. There are actually scales dedicated to infertility stress.
Okay.
And there are two sides of the camp. Does infertility cause stress? And I've done research on that.
hmm
And does stress impact fertility? And I've done research on that. So I'd say starting with the first, does infertility cause stress? I published a paper probably 25 years ago that showed that women with infertility had the same level of anxiety and depression as did women with cancer, AIDS, or heart disease. And
Mm-hmm.
that was a great study for my patients
Yeah.
because, when people are going through infertility and, we know the majority of women going through infertility have clinical levels of anxiety and depression. And we know the majority of men have anxiety and about a third of them have depression. So this is a very, this is a population that's suffering terribly.
Yeah.
So we know there are lots of psychological symptoms. And so it was just great for my patients. When I published that study, I was like literally giving away copies of the study for my patients so they could show their mother and mother-in-law, say, look, see, this is really hard. It's not just me. It's very normal to
Yeah.
feel anxious and depressed as you go through this.
Yeah.
And then when COVID hit, it hit Boston very hard because Biogen, which is one of the life science companies here, had a big meeting at a downtown hotel, and there were like, I don't know, 70 people in one room. And someone, I think it was a woman, had flown in from China. And of course, no one knew at that time that she had COVID. And it ended
Mhm.
up being that 300,000 people ended up getting COVID from that meeting. And
Wow.
so Boston was hit very hard. The Board of Health shut down all infertility clinics. Our patients were absolutely frantic.
Yeah.
And so we actually sent out a questionnaire to our patients, in effect saying, what's harder, COVID or infertility? And
Right.
I was very convinced that our patients would say infertility. And my co-investigators were equally convinced they would say COVID, because at the beginning, going to the
Yeah.
grocery store felt like you were going to war.
Is the world
Um,
ending? Yeah.
exactly. And I was right that patients really said that infertility was just really, really hard, even compared to COVID.
Yeah.
So
Wow.
it's just a snapshot of infertility impacts every area of a couple or individual's life. And so, I feel like I spend a lot of time just telling my patients, you're normal. Like, it's normal to be upset when someone gets pregnant. It's normal to be upset when you see baby pictures on social media. It's normal not to want to go to baby showers. It's normal to feel jealous when one of your
Mm.
siblings gets pregnant.
Yeah.
Um, and so I think normalizing their suffering is really important. So it's crystal clear that infertility causes a lot of stress. I don't think there's anyone that would argue with that.
Yeah. No, yeah. I won't. That's yeah.
It's the other part that's so controversial.
Hmm.
Does stress impact fertility?
Right.
And, I think one of the things we've all, I've battled with most of my career is, there have been, I don't know, probably 100 studies that have looked at women's stress level before they start an IVF cycle.
Right.
And basically they say, okay, are women who are anxious and depressed before an IVF cycle less likely to get pregnant because they're anxious and depressed? But the sort of the mediating factor here is that, women know their prognosis, or most women know their prognosis. And so a 25-year-old who's got, an AMH of 8
Yeah.
is probably not going to be that stressed starting an IVF cycle, because her physician has probably told her, you got a great chance.
Yeah.
So if she, expresses very little anxiety or depression before her cycle and gets pregnant, did she get pregnant because she wasn't stressed, or did she get pregnant because she was 25?
Yeah.
Versus a 44-year-old whose AMH is undetectable, whose physician has said, okay, this is a closure cycle. I really don't think this is going to work. And so the patient is obviously going to be anxious and depressed. And she does a cycle and doesn't get pregnant. Now, did she not get pregnant because she was anxious and depressed, or did she not get pregnant because she's 44?
Yeah.
And so you really can't rely on how patients express their emotions, because there's so many other factors.
Right.
And so you really need to look at physiological measures. And a group, it's somewhere in Europe, and my husband's going to laugh at me because he says I'm such a smart person to be so stupid about geography. I want to say it's the Netherlands, it's somewhere. Anyway, they published 2 studies now on looking at hair cortisol and IVF outcome,
Okay.
because the cortisol levels in your hair are pretty good representations of the cortisol levels in your body for the previous 3 to 6 months.
Yeah. Yeah.
And
Timeline.
cortisol is our stress hormone.
Hmm.
And both studies showed that the higher your hair cortisol, the lower your IVF pregnancy rates were. And so, I of course run up to the presenters when they're presenting, and I say, oh my God, this is amazing. Shouldn't we just be testing all patients for hair cortisol? And people with high hair cortisol, we should have them do a mind body program or see a counselor or learn meditation. And the
Acupuncture.
problem with looking at hair cortisol is that you have to shave a significant portion of a woman's head to get enough hair to measure cortisol,
Oh, really?
which is
Okay.
a big detractor. Yeah. So
Okay.
you're not going to find women who are willing to have parts of their head shaved.
It has to be hair near the scalp, I guess, right?
It has to be hair from the scalp. Yeah. So, great science, really interesting publications, but I think not clinically practical.
Mm.
So I was approached by a company called OTO, maybe 2.5 or 3 years ago, and they're actually based in Canada. And they make this device, which actually used to be used, I think, I want to say either the Russian or the Ukrainian Olympic team. And it's been used by Navy SEALs and the NFL and all kinds of different populations. And basically, we don't use the word stress. What auto measures is your central nervous system and your cardiovascular system,
Mm,
you know, how much are they in the fight or flight mode, or how much are they in a relaxed mode?
hmm.
And this device gives you 54 measures of physiological stress.
Wow.
So they funded a study that we are in the middle of analyzing the data of, where we recruited 240 women who are about to start their first IVF cycle. And they wore the device for like 3 minutes every morning for a week of baseline before they started their first IVF cycle.
Yeah.
And they wore it for the 2 weeks of their stim, so the stimulation medication.
Yeah.
And then they, for the 4 weeks of their frozen embryo transfer cycle. So
Mm-hmm.
we have 7 weeks of data on all
Wow.
our patients.
Mm-hmm.
And we presented, wow, 2 weeks ago at the American Society of Reproductive Medicine meetings, just the first batch of data that we had analyzed, where we looked at the cardiovascular and central nervous system stress level. We compared their baseline versus a stimulation phase. And it was extraordinary. You
What
know,
happened? I'm
the
so curious.
differences, I mean, they were, in statistics, you look at what are called p-values.
Yeah.
And for something to be statistically significant, a p-value has to be less than 0.05.
Mm-hmm.
And like this data was like 0.00016. I mean, it was extraordinary how physiologically stressed these women were during the stimulation phase of their cycle.
Like
And
resting heart rates and all kinds of
everything. Yeah.
metrics like that, right? Okay.
So we're now analyzing the data to see whether or not their baseline or the 2 weeks of stim predicts pregnancy rates. And that's going to
Mm,
be very hot data, very
yes.
controversial data, but it's physiological, it's not self-report. And other than shaving women's heads, it's a whole
Yeah.
lot easier to wear a device for 3 minutes a day than to have had your head shaved.
I love this, these other metrics that are being utilized here, and it's not just blood or plasma,
No,
metrics.
I mean, as I said, this device has been used by Navy SEALs. As I said,
Yeah,
I mean, I think it was the Russian Olympic team that used it to improve resilience in athletes.
nice. I mean, I'm just slowly starting to see, people utilizing and understanding, some of the feedback they're getting from the Aura Ring, and
Mm-hmm.
because they're helping chart women's cycles. They get a notification in the morning. It's like, oh, you're in your luteal phase, or it's pretty amazing stuff, and um, so I'm so excited that you're already accumulating data on points on that.
As I said, we can't make recommendations to patients
Mhm.
until we have data. And, I think that, if, and this is a big if because we haven't analyzed all the data yet, we're doing it now, literally. If we find, in fact, that central nervous system and cardiovascular stress at baseline or during stim is actually significantly correlated to IVF outcome, then we
Mhm.
have solid proof that, if somebody scores high on the auto device, we need to intervene. We need to
Right.
teach them stress management. And so Otto is funding a second study which we're calling Otto 2 because we're very original.
Yeah. Awesome.
We're going to be recruiting 240 women. And half of, they will all wear the Otto device, same thing, baseline, stim, FET. But half of them are going to get feedback from the device in terms of how stressed they are physiologically. And there'll be suggestions on the device what to do, like relaxation techniques and stress management and simple exercises. And the
Nice.
idea will be, okay, if we can recognize someone's stress level is high and they do things that bring down their stress level, are
Mhm.
they more likely to get pregnant? And
Right.
that will be an enormous gift to the field.
Yeah. Amen. That is so great. Um, so that, yeah, I guess that's gonna finally, it's easy to triangulate and find ways, interventions, that we do know that can help with a lot of those metrics, right? So that's just gonna kind of, give way to the necessity of implementing, some of these things for almost anybody, which
Well, exactly. I mean, the other thing is, as I've been fighting all the naysayers in my career,
mhm,
another source of proof that stress impacts fertility is if you look at the data, certainly and more the data from the last, 5 to 10 years, that women who go through some kind of psychological intervention, specifically ones that are like cognitive behavioral therapy or mind-body focused, women who go through these kinds of interventions are significantly more likely to get pregnant. And I've done 3 randomized controlled trials, and all 3 have shown that women who do a pretty intense psychological intervention are anywhere from 2 to 4 times as likely to get pregnant as the control group.
Amazing. I had a question about those studies. Were any of them online tools, or was that a part of
Yeah,
some?
in fact, the last one was the dissertation of a graduate student at the University of Vermont named Jessica Clifton.
Okay.
And so she took my in-person mind-body program for infertility, and she turned into a online mind-body program for infertility.
Got
And
it.
she recruited, I want to say 77 women with infertility and randomized them. So half of them did the online program and half of the control group. And we found the women who were randomized to do the mind body program were way less anxious, way less depressed, way less angry, and 4 times as likely to get pregnant as the control group.
Wow.
We
Yeah.
published
Well,
that.
preaching to the choir, but I love for people to hear this, because I think unless it comes straight from, I don't want to use that term, but straight from you, let's say, someone who is deep in the field, the research of this, that, sitting at home for 10 minutes and meditating in these practices, getting out into nature more, whatever it might be, does matter. And,
It does
or
matter.
at least even may play a role, until we can say 100% conclusively, which to me is a no-brainer. But the data has to, point there is really powerful. So that is a great message for anyone listening to hear.
Well, I think my message for anyone listening is don't suffer in silence.
Yeah.
And there are people who cope really well with infertility. I don't see them as patients because they don't need to see me. But there are people out there who just, plod through and do okay. And it might be because they have a really supportive partner, or they have great coping skills, or a wonderful family, or lots of friends, or they just are the kind of people that let things roll off their back.
Yeah.
But the majority of people, as I said before, who are going through infertility are suffering terribly. And, I feel like it's my job before I retire to come up with what is the easiest, most effective way for people to bring down their levels of anxiety and depression, A, so they're not suffering, and B, so they increase their chances of pregnancy.
Mm-hmm. Of course. So can you give any ideas or hints in that sense? Like, I mean, what is kind of the minimum required dosage of meditation or even exercise or speaking with a counselor that you think that people should at least strongly consider moving forward?
Okay, I'll say I have absolutely no idea because there hasn't really been a study looking
Yeah.
at relaxation or meditation or exercise per se.
Yeah.
The research, and if you look at like these meta-analyses where they look at 100 studies of psychological interventions, and some of the best ones are done by a group from Denmark.
Yeah.
What they have shown is the most effective interventions, as I said, are cognitive behaviorally focused. So they really focus on helping participants learn how to challenge automatic negative thought patterns, and or mind body programs that combine cognitive behavior therapy with relaxation strategies.
Mm.
There's I couldn't even tell you how many studies there have been, because every time I read a meta-analysis, one of them will say we found 35 studies that met our criteria, and somebody else in the same time frame will say, oh, there are 42 studies that met our criteria.
Right.
But I'd say probably in the last 5 years, the vast majority of these meta-analyses have shown that specifically women, a few men, but mostly researchers on women who do one of these interventions, significantly reduce their psychological pain, which I think is really important. And they also significantly increase their chances of getting pregnant.
Well, from a clinician's perspective, like we Chinese medicine, naturopathic medicine, that's what we've done, focusing on reproductive
Hmm.
health and IVF and fertility for like I said, 20 years for me now as of this date or yesterday. But um at this time, and for years now, the patient or the client's experience going through the IVF is as important clinically to me as doing everything we can to optimize their body.
Hmm.
And I can't, that's not based on data. That's just based on what we see are the needs of the human being in front of us
Hmm.
going
Absolutely.
through something in life, an IVF.
Yeah, I think one of the reasons it's really hard to answer a question about what's the most effective intervention is that everyone's different.
Mm,
And so
mhm.
I could never sit opposite a patient, and I still have a small private practice, so I still see patients every week. I can't look at a patient and say, you're going to do best in a mind body group, and you're going to do best with acupuncture, and you're going to do best with meditation, and you're going to do best starting an exercise program because
Right,
no one knows.
right. Yeah. That's very individualized
Yeah.
and I guess that's what we try to do clinically, get to know
Right.
someone so deeply that it's like, well, why don't you just try and exercise? You love it and you haven't been doing it, or or get out there dancing again, things that they love to do and for sure aren't doing because adulting is too busy and too serious or,
Yeah, but
you know,
honestly and truly, when I have a patient say to me, I'm too busy to meditate for 15 minutes a day,
yeah.
I'm like, really? How much time do you think a baby's going to take? It's way more than 15 minutes.
Right.
So, I
That's
think we waste a lot of time being anxious. We
yeah,
waste a lot of time on our phones. We waste a lot of time looking online.
yeah,
Um, one of the exercises I do with my patients is I say, I want you to actually document how you actually spend your average weekday,
yeah,
every hour of your 24 hours. And they can probably come up with maybe 20 hours. I'm like, well, maybe the other four is just your anxious time. But people have a lot more free time than they think they do. Let me rephrase that. Some people have a
yeah.
lot more free time than they. I mean, there are obviously people who are listening who work two jobs, are caring for an aging parent. There are lots of other life responsibilities, but a
Yeah.
lot of people waste a lot of time.
Yeah, check their screen time, and it's evolved a lot over the last few years in particular, but almost all issues with sleep I see in the clinic are TikTok-itis or
Mhm. Yep.
Instagram, time, and it's a real thing, now. So that's going to be something we'll have to, look into too. We recommend media cleanses all the time, especially, I don't know, right now in the US, you can't really get away from it.
You
But
can't, I mean, it's funny, every Saturday morning I get this alert. I don't know if it's from Apple or Verizon or whatever, telling me what my usage was, my daily usage was in the previous week. And I hate seeing that because, I don't spend that much time on my phone, but I get both my work and personal emails on my phone.
yeah,
And so if I'm not near my work computer, the only way I can see my work emails is on my phone.
yeah,
So I try to assume that at least half of my phone
yeah, is
time
work
is looking at
related.
work emails.
Yeah, yeah. It's a real thing, and but I feel like there's an awareness growing about that in general, in the human adult population, at least in the where I am, that people are like, huh, I gotta not be on my social stuff so much or whatever,
Yeah.
which I
Yeah, the
think
problem is the younger people still spend these days more time on their phone than they do with friends.
socially,
And,
yeah,
and
yeah,
that's really scary.
yeah, it is scary. And then when they are on there listening to the young influencers versus the Alice Domars or
Well,
but
because you know what? Honestly, if you're someone going through infertility, would you rather hear me talk about what you need to do to feel better? Or would you rather hear someone say, oh, just do this vitamin and presto, you'll get pregnant? You
yeah,
know?
that's true. Buy it here.
Yeah.
Yeah. Yeah. Well, one thing I've learned is, supplementation, all these things are just a piece of the puzzle. You've got to kind of
Yes.
step and take care of yourself in life, period, and that's great. And so how have the mobile applications, speaking of getting off our screens, but
I just get right back on them. Yeah, so Liz
how,
Girl and I created two apps, Ferticom for women and Fertistrong for men.
Mhm.
And Ferticom did really well. So clearly women liked, I mean, the idea was we're both psychologists. I think between the two of us, we have like 70 years of experience. And we thought of the 50 situations which really push our patients' buttons.
Yeah,
Like, going into the bathroom and seeing blood, or being at a holiday dinner and your little sister saying she's pregnant. I mean, there's just a lot of situations that are hard. And then for every one of those situations, we came up with 6 things they could do in that moment to help themselves feel better. And as I said, it did well. Fertistrong did not do all that well. I think it's hard to get men to
yeah,
acknowledge. And, Ferticom for women was just stuff they could do. Fertistrong, half of it was what men could do to feel better, and half was what could they do to better support their partner.
yeah, which is
But
essential.
anyway, about 2 years ago, so it was licensed by Ferring Pharmacy. Both of them were licensed by Ferring Pharmaceuticals, so they were free.
Yeah.
And then when that license expired, Ferticom was licensed by Curio Digital Apps, and they took it off the market because they are creating a platform that Liz Grill and I are actually helping create the content for. And the plan is to actually do a randomized controlled trial.
Mm,
We never did a randomized controlled trial with Ferticom, or we actually did a small one with Fertistrong, got significant results and published it, but we never had a chance to do a study. So here I am running around going, don't do anything unless there's data.
yeah.
Ferticom didn't have data, but Curio is creating this product called Fertilift, and hopefully in about 2 months we're going to commence first a registry, which is going to be a randomized controlled trial, and then an FDA trial. So we're
Wow.
going to have ideally very solid evidence on the efficacy of their platform at, reducing anxiety, reducing
Right.
depression, et cetera, et cetera.
So on a mind body basically online platform and support
Yes.
application.
And
Okay.
some AI, which is kind of cool. Makes me feel very hip that I can even use the word AI.
Woohoo! Yeah, that's awesome. So what that Fertistrong, I saw it, but I didn't dig into it. What can you just give the conclusion from that? It was with the men?
Yeah, so, with Ferticom, literally like the day it was finished, a Farron released it. And, so we never had a chance to do research, but with Fertus Strong, we actually had a month in between when it was built and and they were going to release it on Father's Day.
Yeah.
So we did a small randomized control trial at Fertility Centers of Illinois. And we recruited, we had like 2 days, we recruited 38 men
Yeah.
and randomized them. So half of them had access to Fertus Strong and half of them did not. And we
Hmm.
followed them for 28 days. And even with these two tiny groups of 18 men in each group, we had some significant results, which is why we were able to publish it. That
Mm,
men who used Fertistrong, had some significant psychological benefits.
awesome. I mean,
But we need to do more for men. There's no question.
well, I mean, there's very little focus on men, and we try to obviously in our clinic. I'm sure you do too, because if they're strong, they can support their wife. I mean, but it's mostly because they're not going to carry a pregnancy, so the emphasis is
Right.
just so small. But
I mean, I see that I hear this. I just had a conversation with a patient about this yesterday, that she was saying that a friend of hers got pregnant and she was super upset. And I get it because every one of my patients gets super upset when anyone else gets pregnant. But her husband, like, well, wait a minute, her getting pregnant doesn't impact your chances of getting pregnant. Why are you upset? So there are huge male-female
oh,
differences in a lot of aspects of infertility.
yeah, yeah, there sure is. I okay. Can I ask you about this one? I think it's 2015, but I had never seen it. But um, lifestyle habits, prevalence of negative lifestyle behaviors. And also,
Yeah.
kind of, what were some of those? Like, do you
I
remember?
was actually surprised because I think the recommendations to patients is pretty consistent
Hmm.
to, not just stop cigarette smoking and now, any marijuana intake, but also not have any exposure to secondhand smoke, to drastically reduce alcohol intake, to decrease caffeine intake. I mean, you just go down the list.
Hmm.
And we did a survey, and this was 9 years ago, so I actually can't tell you the exact data, but
Yeah.
we were surprised that and this is when I was still at Boston IVF, where they're told by their physician and team what lifestyle behaviors to modify, and then they get it in writing, and it's even on the website. And
Yeah.
I was surprised how high some of the quote unquote negative lifestyle behaviors were.
Yeah.
I've always, every time I give a talk about infertility, I'm always saying, procreation is the strongest instinct in the animal kingdom.
Right.
And people, infertility patients will pretty much do anything to try to get pregnant.
Yeah.
And so it was shocking to me that even if your physician says, you got to cut back on alcohol consumption, or, cut back on running marathons, how many patients did not change their lifestyle habits?
Wow. Yeah. Yeah. I see it. I see it, particularly men, but yeah, I see it.
I mean, you also have this whole issue in this epidemic in this country of obesity.
mhm.
And that we know for both men and women, being obese, especially if they're morbidly obese, decreases fertility, and it decreases the efficacy even of IVF.
Yeah.
And yet it's very challenging to
Mhm.
support patients to lose enough weight so that they can do IVF.
Yeah. Ozempic babies. There's
Yeah, there are a lot of Ozempic babies, not necessarily from infertility patients. There
yeah,
are a
yeah,
lot of
yeah. That's
PCOS
true.
patients.
That's
Yeah.
true, right? So okay, from a clinical perspective, like the IVF center, this was kind of neat. I think this is something you're working on currently, and there's two of them. Maybe I'll go back in time a little bit, but physician empathy during the
Oh, yeah.
2 week wait. What
Yeah,
can you?
so when I was at Boston IVF, they have a fellowship program,
Yeah,
and usually they do every fellow has to do spend a year doing research, and it's usually like clinical research done in the lab. And one of our fellows named Jamin Shaw, this is probably 5 or 6 years ago, did a research study with me on empathy, on the impact of physician empathy, or how they communicate.
yeah,
And so I trained him how to specifically communicate empathically.
okay,
And so he did a study where we, recruited patients, and half the time, he communicated empathically, and half the time he did not. And there were major differences in patient perception of care.
hmm.
And so we sort of are using that data now. And I've been like bopping around the country doing empathy training for our physicians. And
Yeah.
again, it's actually Therian Pharmaceuticals has been sponsoring these dinners where honestly and truly, I'm almost torturing our physicians because, we invite them to a nice restaurant. They all come thinking this is going to be great. And I give a brief talk on empathic communication and the do's and don'ts and what you should and shouldn't do. Then I have, I think it's 14 different vignettes where I have a physician. Each physician takes turns where they play the physician, and then other physicians play patients or nurses or someone in the clinic. And it's the vignette is a very difficult conversation.
Right.
And so these poor physicians
Yeah.
start, as they would, having this conversation. And I interrupt halfway through and I'm like, okay, that was okay. But
Yeah.
maybe you could say it this way.
Yeah.
Or
Yeah. Well,
because it's important.
it is. I think when you forget kind of how, that there's a human in front of you sometimes, that, and all due respect, but that because it's so busy and it's your job, and you're kind of end up going through the motions. We're all guilty of that to some degree in our relative professions, and we're respected.
Mhm.
But it to just be reminded once in a while, I think is important, probably.
But it's interesting. The first one I did, and I will not name the clinic. So it was I think almost all the physicians, and then senior level people, the nursing director and the office manager, et cetera, et cetera. And the physicians actually enjoyed the evening, and they felt like they learned. And I've done this now probably half a dozen times with
Nice.
different clinics, and I have a bunch more scheduled for 2025.
If one's out
And
here, let me know. I'll come. Mhm.
and what's interesting is that the staff notices that the
Yes.
physicians are communicating differently with patients and with them.
Oh, there should be research done on how happy the nursing staff is.
Yeah, because everybody in the world wants to keep infertility nurses happy.
Yeah. Oh, yes. Yeah. They're the lifeblood.
They
Yeah.
are, and it's a really hard job.
Yeah. Big time. So, what about the embryologist stress? That's
So I
current.
just
Current?
participated in a couple studies that were sponsored by Tomorrow, and we looked at the levels of stress of embryologists in the US and compared those to stress of embryologists in the UK, and they're really stressed. I mean, I don't think I realized how exact what they do is until I was at a conference a couple of years ago, and they actually showed a video of every step an embryologist needs to take to thaw an egg.
Mm.
And it was like, I can't even tell you how many steps and how many, you know, alarms they had for, I mean, not just like timers and it is such a delicate, demanding, time intensive career.
Mm.
And, they create life. It's amazing what they do, but you can't make a mistake.
Wow. So is that impacting their stress then? How it has to then on some subtle levels maybe impact. I don't want to throw them under the bus with quality of their work or anything, but what is there any conclusions kind of from if they are taken care of properly, like their stress levels?
Well, a few times a year, I take out all the embryologists from clinics for a really fun dinner and
Yeah,
just talk to them about how much they are appreciated.
yeah,
And I think everybody needs to hear that often. I
sure.
think embryologists need to hear it most often because they
Oh,
work really hard.
okay, okay. Um, I I have to say over the years, in a lot of respects, I've seen more eye to eye with embryologists than almost anyone at clinics sometimes with respect to care for the body and the follicular genesis cycle
Hmm.
and care for the human in that antral follicle phase, etc. Um, so I have a huge respect for what they're doing, but I had no idea that it was maybe quite so involved as you express.
I think unless you actually see what goes on in an embryology lab,
Mhm.
you don't understand how intricate the process is. I mean, we think, okay, you take eggs, you take sperm, you combine them, they make embryos. You let them, you know, incubate for a few days, and then you freeze them or you biopsy them, you transfer them. But it's a very exact science.
Yeah, well, and I guess it does all right on. It's usually two or three of them or something in a clinic.
Well, it
Like,
depends. It depends on the size of the clinic. I
yeah,
mean, there's some
yeah,
clinics that
obviously you're
have.
right. But
I've
but
literally taken 30 embryologists out for dinner from one of our clinics. So
oh
some of them have,
wow,
yeah, some of
big.
them have
Well,
huge clinics.
but they're such a like a lot of what other people do doesn't like impact whether or not the cycle will fail. They have these very critical steps that they take care of.
Mhm. Yeah, they do. And
Yeah.
I think that, and some embryologists actually really like talking to patients. And so,
Mm,
if I talk to a patient who happens to be at a clinic where their embryo, I mean, an embryologist, they are very much part of the process and they want to know which patients get pregnant because they're so invested in the outcome.
uh, yeah, I would imagine. They've taken care of things for a while, and then yeah, interesting. Okay, well, I'll try and get the embryologist in to see my staff more.
The theme here is hug an embryologist.
Yeah, yeah, there we go. You should create a day. Embryologist day. But awesome. So I mean, we're hitting that approximate hour mark here, and I know we both got patients to see her. I'm not sure where you're off to, but what is there anything else you wanted to touch on, or like maybe uh you know remarks for patients in there because they're doing this due diligence that is unbelievable sometimes. Like by the time they're through a couple of IVFs, they could probably pass an REI exam. It's
Yeah.
uh,
As I said, my number one piece of advice to infertility patients is do not suffer in silence.
mm,
There's, lots of people in the US and lots of people in Canada, mental health professionals who specialize in reproductive medicine.
mhm,
I would say your relationship with your REI is just like any other relationship. There needs to be some chemistry.
Yeah.
And if you're not happy with your doctor, but you like another doctor in the practice, switch or go to a different practice, because you deserve, what we call patient-centered care.
Right.
It's really important. You have to feel like you're getting really good quality care.
Yeah.
Don't expect your partner to feel the same way you do. That's one of the biggest myths I see when I see couples. Each of you is coping in the way you need to cope, and don't expect your partner to cope the way you're coping.
Got it.
And do not force yourself to go to baby showers or gender reveals or first birthday parties or anything else. I mean, right now you can just say you're exposed to COVID.
Yeah.
I used to tell patients, just tell them you have a GI bug.
Yeah.
But do not go to anything you don't want to go to.
Yeah. Yeah.
It's a temporary crisis, but during this temporary crisis, you need to be really aggressive about nurturing yourself.
It's a chapter of a few spiritual divorces that aren't forever. It's a chapter. Yeah.
Yep, exactly.
Yeah. Okay. Those are amazing advice, even just on the physicians, because sometimes, all in every physician's defense, it just may have been a bad day or there isn't chemistry or whatever. It doesn't matter. I mean, someone else there will likely roll out the red carpet a little bit more if they, know that you needed something different or different bedside, or they want the guy that has all the research, or they, you can kind of get to know someone and recommend, at least in where I am, I know the REIs quite well and can give them ideas.
But that, I would say that's true at most clinics is, if you have 10 physicians, you're going to get 10 different personalities. And so, what I will still say to patients is if you're happy with the clinic, but not your physician, and you've met a different physician you like better, I can tell you the clinic would rather you switch physicians and stay within the clinic than left the clinic.
Then go to the competitor. Yeah. Well, and also you don't see your physician that often.
No.
So,
it's the nurses that tend to make a difference.
Yeah. So hang in there. And I also am like, and that's the follow-up is, well, why aren't everything should be under one roof? Because I'm like, well, you don't go to the IVF clinic expecting, hand holding. Like that's not what they're doing, and so you need to find.
But I would actually disagree. I feel like this is why I've been doing research for the last couple of years on patient-centered care.
Yeah.
That patients do need to feel that they are cared for. That is not just a factory.
Yeah. I agree, but it's just a fact that it's kind of not all under that one roof yet, where there's a you, in every IVF center that is there to make sure the embryologists are okay and the physicians are speaking empathically with their patients, and there's an acupuncturist in the corner office, and they've got, it's
maybe I'll start a movement. Like if Inception has a chief compassion officer, and I'm trying to get a psychologist in every clinic, maybe it'll catch on.
Awesome. Yeah. Well, that's like the national program here in Canada. It might be it's a lot fewer prelude clinics here. We might be able to kind of start a pilot or something up here, and getting the clinics up here on board with some mind, body, and acupuncture, and seeing how, and getting some data on those things. And
well, one thing that we did roll out at all our prelude clinics was we have this really innovative fertile yoga program.
Yeah.
And it's like half fertility yoga and half support group. And I think we had almost 500 patients sign up within the first couple of weeks. And
I love it.
I see some of the comments that are posted, and patients are just really happy to be part of it because they're learning a coping technique, in this case, yoga.
Yeah.
But they're also with women who get it.
Yeah.
And that's very powerful.
Yeah. Yeah, that's true. And from a really practical perspective, I love yoga as a physical activity because it there's breath work, there's stretching, there's musculoskeletal stress, it kind of combines, and there's everything into one. So it's just this nice holistic middle road. A lot of fertility things are kind of middle road, in my opinion, to be optimized, for your reproductive potential.
And the fact is, there is some data on yoga, which makes me happy.
That's great.
And, I'm constantly telling patients to not exercise vigorously.
Yeah.
And so then transitioning to hatha yoga keeps them fit and toned.
Yeah.
but does not have an adverse impact on the reproductive system.
Yeah. 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 And how do you find with exercise? Is it a little bit relative? Like someone comes in a marathoner if they're still doing 10K a week, or sorry,
Yeah, that
kilometers.
worries me. I mean,
Yeah.
I think what the research pretty much points to moderate exercise is best.
Yeah.
So
Yeah.
being a couch potato is not good, and being a marathoner is not good.
Yeah.
But taking walks and, doing somewhat gentle bike rides and swimming, those are all great,
Yeah.
both
Yeah.
for your body and your mind.
Yoga and yeah. Yeah. Exactly. Okay. Yeah. That middle road kind of idea.
Exactly.
Amazing. So please don't go anywhere anytime soon. And I'd love to more
I'm
chat
not
more about.
allowed to use the R word in front of my boss,
No,
so
no, yeah, don't do that. Don't do that. That just means you're doing something you don't want to do, and I know that's not the case right now. So
no,
that's great.
I'm very happy what I'm doing right now.
Awesome. Well, I'd love to continue chatting anyway, too, how I can contribute. I love the group out here, and how we can pilot anything that you think might be worthwhile, or you and I could kind of come up with a little pilot out here. PCRM would be in. I know the nurse team there. I'm in love with them. They're an amazing group, and they'd be behind us too.
Yeah, I
To
visited them last year and they are an amazing. I mean, honestly, I'm trying to roll out having a mental health professional in every clinic. And, when
yeah.
I was at Boston IVF, we had a large integrated care center and we had anywhere from 5 to 7 acupuncturists because we offered acupuncture 7 days a week, 365 days a year.
Mm.
And I truly believe that's a wonderful service to offer to patients. So I'll deal with a psychologist and then I'll move on to acupuncture.
Well, I'll push in that direction too then. Awesome. Awesome. Well, amazing. It doesn't sound like you're heavy on social, but this is kind of the
No, not at
social one.
all.
Yeah, yeah. I'll put some links to, if anyone's interested in Ali's or Dr. Domar's research, her CV at Harvard, if you don't mind, Ali, I'll put a link to that and a few of these other things we chatted about. If people want to look through your research and
You can
and
look on the Prelude website because I think that also includes a lot of links there too.
okay. Well, then maybe I'll find that link there and include it in the
Perfect.
show notes and get the word out. Otherwise, exciting. We could talk again maybe about Conquering Infertility when it's re-released. I'm pretty excited about that.
It's supposed to be January. We'll see. It's supposed to be. I mean, it's going to be re-released. There's going to be a batch for Prelude patients, and then I believe it's going to be released to the public as well.
Oh, good. Oh, good.
Yeah.
Awesome. So I'll see that out in PCRM then. Um, That's great. Well, yeah, I mean, somehow if there's a list, put me on it. I would love to know and have that in my
I'll
clinics
tell
as
the
well.
marketing team.
Yeah, yeah, yeah.
But I
Cool.
do have to run because I do have a
Yeah, me
patient.
too. Me too. I've got a patient, I think, waiting outside. So anyway, it was such a pleasure, and we'll chat again soon, and I'll let you know when this is out. So or I'll let Anna know your publicist,
Okay,
and so we'll.
sounds great.
But it was great to connect.
You too. Have a good
All right.
one.
Talk to you again
Thanks.
soon. Okay. Take care.
Okay.
Bye bye.
Bye.